difference between endogenous and exogenous.
The endogenes having from the normal flow.
Endogenous what?
From the normal flow.
From the
Normal flow of the body. And that is from the other, from the outside. From the outside of the body, like
I said that some bacteria are as normal flora in our body. What is normal flora? Huh? What is microbiota? What is microbiota?
Microbiota is a non-natural term for all species of bacteria and fungi, parasites. Okay, they present naturally in the body.
Do you know microbiota? Do you know normal flora? Explain more. You listen to the others explain. Do you know microbiota? Microbiota? Huh? You were in the Dr. Sirus's class? Yes? Do you know microbiota? Explain. Some bacteria can colonize in several parts of the body, okay? For example, on the surface of the skin, some bacteria colonize. And they cannot cause any disease. For example, in the colon, some bacteria can colonize. And they have some advantages that I explained. They cannot cause disease. Every part of the body, or most part of the body, have several bacteria as normal flora or microbiota. Do you understand? Please, do you understand? Yes? If this bacteria move from their habitation to another site of the body, can cause disease. Yes, you understand? This infection is an endogenous infection. I said, for example, the bacteria which colonize on the colon and is a microbiota of the colon. If moved to, for example, urinary tract, can cause infection in urinary tract. This infection is endogenous infection. Yes? Yes? Do you understand?
What's the reason that leads bacteria change its position outside?
Why?
Yes, what's the reason?
Yes, there are several reasons. Okay. Some of the reason is, for example, during a surgery. Okay. bacteria that colonize out of the body. For example, there are some bacteria on the surface of this chair, okay? And there is some scratch in my skin. If I touch it, maybe this bacteria cause one infection in my skin. We say it is an exogenous infection, different from endogenous infection. For laboratory diagnosis of anaerobic bacteria, some points must be attention. At first, because most of infection that related to these bacteria are endogenous infections, during collect the specimens, you must notice that the specimens are not contaminated with normal bacteria. For example, there is a wound in my hand, okay, and I want to prepare a specimen for culturing. I must attention that the other bacteria in my skin don't contaminate the specimen. These bacteria are very sensitive to drying, and drying causes significant bacterial loss. Their specimen must be kept in a moist environment. Most of endogenous infections are polymicrobial. That means, I say that most endogenous infections are polymicrobial. What is meaning this sentence?
Should I repeat one more?
Huh? I said
Yes.
most endogenous infections are polymicrobial infections. What's the meaning of this sentence? That means several bacteria take part in one infection. For example, I can isolate from my wound Staphylococcus aureus and also Pseudomonas aeruginosa. So, two bacteria can isolate. And it's very important for growth of this bacteria require line incubation. Except Bacteroides brachylis that grows rapidly. Treatment. Antibiotic therapy combined with surgical intervention in the most of the time, because the bacteria colonize on the deep of the tissue. By surgery, we must remove this tissue. You understand? We say surgical intervention. And this bacteria, most of this species causes beta-lactamases. Maybe these bacteria are resistant to penicillin, cephalosporin, because the beta-lactamases destroy this antibiotics. Metronidazole is the most important antibiotic. It's used for anaerobic gram-negative bacteria. The second choice is carbapenems, such as imipenem, meropenem, and also beta-lactamase inhibitors, such as piperacillin, tazobactam. And prophylaxis treatment with antibiotic used for prevention of these infections. The girls, mother,
A?
raise your hand. A,
No, no, C.
raise your hand. A,
No.
B, C,
Yes.
D. Okay, read this phrases. Say that he is saying plainly anaerobic, obligatory anaerobic bacteria. Okay. Question 2.
C.
When you read this question, you notice that Bacteroides fragilis. Bacteroides T. Bacteroides fragilis is anaerobic bacteria, and the best antibiotic for anaerobic infection is metronidazole.